The landscape of cardiac biomarkers is shifting from simple damage detection like troponin to pathophysiological profiling. For a clinician focusing on diagnostics, the most relevant newer biomarkers are those that help phenotype complex conditions like heart failure with preserved ejection fraction, ATTR amyloid cardiomyopathy, and PVC-induced cardiomyopathy. Advanced heart failure and myocardial remodeling. While NT-proBNP remains the workhorse, newer markers provide insights into fibrosis and mechanical strain, which are crucial for prognosticating patients who may be biochemically stable but structurally worsening. Soluble ST2, a marker of mechanical stretch and fibrosis. Unlike BNP, it is remarkably stable, not significantly affected by age, body mass index, or renal function. High levels, more than 35 nanograms per milliliter, strongly predict hospitalization and death across heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. Galectin-3 reflects active macrophage-mediated fibrosis. It is particularly useful for identifying patients who will experience rapid remodeling. MR-ProADM, mid-regional proadenomedullin, a major 2026 update in Circulation 31st March 2026, highlights its utility in transthyretin amyloid cardiomyopathy, that is ATTR cardiomyopathy. MR-ProADM is a superior predictor of mortality and heart failure events in ATTR cardiomyopathy compared to traditional markers. GDF15, growth differentiation factor 15, a stress response cytokine linked to inflammation and oxidative stress. It is increasingly used in multi-marker panels to predict bleeding risk in patients on anticoagulants and overall mortality in chronic heart failure. Moving on to arrhythmias and PVC or premature ventricular complexes induced cardiomyopathy. There is emerging data on how to predict which patients with a high PVC burden will develop left ventricular dysfunction. Inflammatory transcriptional markers. Research published in January 2026 in Circulation, Arrhythmia and Electrophysiology suggests that high PVC burden upregulates interleukin-1 beta and nuclear factor kappa light chain enhancer of activated B cells, that is NFKP, signaling pathways. These markers of smoldering inflammation may soon provide a biochemical rationale for early ablation in asymptomatic patients with a high burden means high PVC burden before left ventricular ejection fraction drops. MicroRNAs, miRNA 208B and miRNA 9, studied as specific markers for ventricular remodeling that could differentiate benign PVCs from those causing structural damage at a molecular level. A recent report noted that these miRNAs may serve as early predictive biomarkers for pacing-induced cardiomyopathy. Early deterioration of left ventricular global longitudinal strain and expression of these microRNAs preceded overt left ventricular systolic dysfunction. Coming to valvular and structural heart disease. Lipoprotein little in aortic stenosis. Beyond its role in atherosclerosis, high lipoprotein little is now recognized as a primary driver of calcific aortic valve disease progression. In patients with calcific aortic stenosis, LPA levels predicted a higher risk of valvular and cardiovascular outcomes, as noted in Journal of American Heart Association 2025. Matrix metalloproteinases like MMP9, used as an exploratory marker for extracellular matrix turnover, providing a window into the transition from compensated hypertrophy to heart failure in patients with severe aortic stenosis. Latest in the field, multi-omics and AI frontier. The newer biomarker is often not a single protein, but a proteomic or metabolomic signature. Proteomic panels. Instead of one marker, researchers are now validating panels of 50 plus proteins. These signatures can predict 10-year risk of a major adverse cardiovascular event, MACE, more accurately than clinical risk scores. Gut microbiome metabolites like trimethylamine N oxide TMAO is gaining traction as a biomarker for gut-heart axis health, directly linked to plaque stability and heart failure outcomes.